Name is Jim Roberg. I'm with the New Hampshire Department of Military Affairs and Veterans Services. I am the skills test and waiver specialist, but I've kind of taken on a lot of responsibilities and really want to do everything that I can to help veterans any way that I can, and military members and families. And I really think that families are the key to every military member because they serve just as much as everybody else and don't really get the recognition. I do want to introduce our speaker. I'm just going to give a brief biography on him, and then I'll let him speak for himself. But our speaker today is Dr. Jim Lynch, who's a primary care sports medicine physician who co-founded the Stellate Institute after serving 31 years in U.S. Army medicine. He is board certified in family medicine and sports medicine and has extensive experience treating those who suffer from the effects of trauma. A veteran of combat deployments to Panama, the First Gulf War, Iraq, Afghanistan, Syria, and several locations in Africa, Dr. Lynch has been a pioneer in the world of PTSD treatment using the stellate ganglion block. He's published multiple articles in the medical literature on SGB, presented his research in international forums in Germany, Australia, and Portugal, and has served as a staunch advocate for improving PTSD treatment options. Beginning in 2011, Dr. Lynch served as a top leader in ultrasound-guided SGBs in the military and trained numerous other physicians to perform this procedure. He has unmatched firsthand follow-up and continuity with hundreds of his SGB patients, having served in the same special operations community with them for over 10 years. This unique patient follow-up and close collaboration with behavioral health clinicians was pivotal in developing Dr. Lynch's deep understanding of how to best utilize innovative SGB techniques in conjunction with trauma-focused therapy. Dr. Lynch was also a U.S. Olympic and Paralympic Committee physician and has supported U.S. swimming and national team as a national team physician since 2011. Skilled in both physical and mental health issues, Dr. Lynch has supported elite Olympians in international competition, including multiple world championships and the Olympic Games. Dr. Lynch has earned his bachelor's in psychology from the United States Military Academy at West Point in 1989, master's in healthcare improvement from Dartmouth College in 2001, go New Hampshire, and his medical degree from Brown Medical School in 2003. He's an associate professor of medicine at the Uniformed Services University of Health Sciences and adjunct assistant professor at the University of North Carolina at Chapel Hill, and an adjunct instructor at the University College Cork in Ireland. And Dr. Lynch lives in Annapolis, Maryland, with his wife, Jody, of 29 years. And with that, I will turn it over to Dr. Lynch so that he can give you a little bit of a briefing, and then I'll take it back whenever you're done.
Well, I sincerely appreciate people taking time out of their day today. You know, some of you, this is your lunchtime, you got other stuff going on. So thanks for taking time out. Sorry we ate up half the time with my bio. I didn't know we were going to go the long version there, but thank you. Really, I'm excited to do this, and thanks for the invitation from New Hampshire. I am a former person living in New Hampshire, and we spent 3 great years up in the Hanover area and love the Granite State. So good to see that invitation come. I also understand that we got people from all over the world that logged on today, and hopefully our Kiwi logged on from New Zealand. But we have had people come to our center in Annapolis from all over the world, including some who's traveled out from New Zealand previously. So anyway. I'm going to turn things back over to Jim here in a moment. He and I met not too long ago, right here in our clinic in Annapolis, and I think that the information that is of interest to many people here, I think, starts best here in Jim's story, and we'll talk a little bit about the finer points of stellate ganglion block. After that, I am prepared to answer any questions about that. If we don't cover your individual questions, I'm always available to reach it after the fact as well. I am deeply passionate about the topic of treating people with PTSD or PTSI and anxiety. I'm a sports medicine doctor and family physician by trade, and I treat physical and mental injuries daily. But my real passion and the thing that I feel strongly about is the ability to help people who've been suffering mentally and emotionally with injuries due to trauma or extremely stressful experiences. And the stellate ganglion block has been a remarkable tool to add to treatment regimens for many, many years. And between myself and my partner, Dr. Sean Mulvaney, who shares the Stellate Institute here in Annapolis, we've done more than anybody else in the world. And as far as the procedures, we've published more original research than anybody else. And for both of us, it's our passion. So he can't be with us here today, but really I'm speaking on behalf of all of our shared experiences over the past 10 years, starting back from its inception in military special operations medicine through all the work we're doing now. So Jim, I don't want to waste any more time. I'd love to turn it back over to you to bring us up to speed. Poor Jim's trying to manage the chat box, bringing people in the room and answering questions. So I hope that's good for you now, Jim.
Oh yeah, I'm good. That's perfect. Thank you, Dr. Lynch. I just want to preface this real quick and let everybody know that this is the first time that I'm sharing this story ever. So if I get a little emotional or my voice starts to shake, it's just my first time, and I'm sharing it because I want to help as many people as I can, and I hope that my story can help someone out there. So again, I'm Jim Roberg. I'm the host and creator of our Frago series, and I'm really beyond ecstatic to have Dr. Lynch speak today. I wrote this story down so I didn't forget anything. So just so everybody knows. So just let me get started. I was fortunate enough to recently be in a clinical trial through the Strive at the University of Ohio to receive this stellate ganglion block and I received it on November 7th of 2022. So I'm a veteran of the U.S. Army. I served from 2005 to 2010 on active duty. I was stationed at Fort Bragg, also now known as Fort Liberty, North Carolina, as a military police officer. So I was deployed to Iraq from October 2006 to January of 2008, and I was assigned to FOB Falcon, where my platoon ran operations with the Dora Iraq Police. After returning from R&R, I was told that we had moved from the Dora IP station, and we were now living at an outpost with Iraqi police in Yusufia, Iraq, which is, if anybody doesn't know, it's affectionately known as the Triangle of Death. It's one of the many points in the triangle, one of the 3 points in the triangle, excuse me. After my deployment, I went to Korea, where my PTSD symptoms really started coming out. I was drinking a lot and had uncontrollable anger issues, and ended up in the Army substance abuse program because I was drinking so heavily, at which time they told me that I was self-medicating and that it didn't really seem like I needed or alcohol in any way. So after my ETS, I went to my local VA in 2010 for my PTSD after a failed suicide attempt. I did not have the best experience with the VA at first, and I decided I could do it on my own. And I was trained to be strong and disciplined, and so, you know, if I couldn't do it, who could? So I struggled for 10 years to keep control of my symptoms. I struggled with drinking, maintaining relationships, nightmares, flashbacks, intrusive thoughts, anxiety, and constant thoughts of suicide and uncontrollable anger. I hid it from a lot of people for a long time until one day in 2020, it all came to a head. A neighbor was shooting fireworks off, and I went into a tailspin. I went into a tailspin. I ended up being hospitalized at the VA in White River Junction, Vermont. The medication helped even me out a bit, but I still struggled in most aspects of my life. I felt like a failure because I had lost this fight and the battle as a whole. I looked at myself as weak, and and I wasn't strong enough to take care of myself. I became recluse and had a hard time trusting people and feeling like anyone could ever love me. I often missed my appointments at the VA, then would reach out when I started to spin out again. This went on for 2 years. And during that time, I found a strong, amazing, and supportive woman, and we decided to have a child. And I was more determined than ever to find a way to get better. I had done some research and found the stellate ganglion block, and this treatment was not covered by my insurance and not offered at the VA. I was strongly considering paying for it out of pocket. Then, while checking my email one day, I had an email from Strive, and they had this clinical trial, and I signed up for it. So when I signed up for the trial, I was accepted into it, and that's where I was fortunate enough to meet Dr. Lynch. So at first, I did some brief cognitive behavioral therapy, which made things harder for me, to be honest, to do that first. But now I feel like it was really helpful. And then, like I said, on 11/7/22, as part of my clinical trial, I went to Maryland and received the stellate ganglion block. And Dr. Lynch was amazing, taking time out of his day to talk to me and make me feel comfortable. After I received the shot, I had a very strange thing happen to me. And after a few minutes of laying on the table, because you have to lay for about 5 minutes after, my arm just fell off the side of the table. For the first time in my life, my whole body just relaxed, or the first time that I can remember, anyways. That was the first thing. It brought me to tears on my way home because I felt alive again. I felt like I was feeling the sun and the wind for the first time in my life. Since then, I no longer struggle with uncontrollable angry outbursts. I don't have anxiety attacks like I was having 2, 3, 4 times a day. I can focus, and most of all, I'm ready to address my traumas in therapy, which I was very hesitant to do prior to. My thoughts are more clear, and I'm able to better process the parts of my trauma that have affected me. I no longer have any thoughts of suicide and haven't since the procedure, which is saying something, because right before I received this procedure, I had a plan and was feeling like it was my last and only option to stop it all. And my relationships are stronger than ever before, and I'm rebuilding relationships that I've lost. This treatment for me has been absolutely life-changing. And I can't thank Strive and Dr. Lynch enough for saving my life, because if this didn't work, I didn't have another option. I didn't feel like, and I really want to thank them for giving me my life back and allowing me to truly live again. So I'm sorry. I told you I might get emotional. I'm very sorry. But with that, I really hope that that can help somebody. That was my first time really telling it, so I feel so good about it. And I want to turn it over to Dr. Lynch to really get into the nitty gritty of the stellate ganglion block.
Well, Jim, I'm sure I'm not the only one thinking this right now, but geez, here you are trying to help others run a webinar, share your story for the first. I mean, I sincerely mean this. The bravery and the courage it takes to do something like that, and over the next few minutes continue on and conduct a discussion about this is amazing. You're an amazing person to do this, because the root of what you're trying to do is help others. But sincerely, let me cover a couple things, and props to you. Catch your breath, and I think prior to this call, Jim and I had spoken, and he since he's become a spokesperson and an advocate, and really trying to help folks within his organization. Many people have reached out to him and asked him questions. And aside from his personal experience and the research he's done on his own about this particular treatment, he gets hit with certain questions, things like, hey, what about PTSD and TBI? What about, how did this all start? How did the SGB come about and things like that? And what about, is this the kind of thing that would work for me? Is really the question I think a lot of people ask. And those are the things that I think would be practical and helpful things to talk about. And I'm happy to do that. I have many years of experience doing this. I think that a lot of the information you can find is we've put on our website, which is the StellateInstitute.com. But just a couple of things to point out, I think that Jim said was the clinical trial that he's referring to is actually still ongoing. And this is through the Ohio State University STRIVE program. It happens to be for veterans only, although much of what we're going to talk about today, not only PTS, post-traumatic stress, but the stellate ganglion block treatment certainly is not a veteran-only issue. And I know most people on here know that. In fact, across the US, the veteran to non-veteran or military to non-military ratio for PTSD, folks who suffer with PTSD is about probably 2 to 1 for non-military. It's that widespread among the 8 million Americans that suffer from this condition. Having said that, the clinical trial is ongoing, and it is funded by a generous donation from the Navy SEAL Foundation. And people travel here from outside the state of Maryland, which is, and anywhere you can get to and conduct the other part of the study with the Ohio State folks. The reason I'm highlighting that is for people who are just hearing about this for the first time, this is certainly not the first clinical study we've done. And the block's been around now for many time. We've treated thousands of people with the block, the stellate ganglion block. And what we're doing now is we're at the point of studying this or researching this to figure out, not does it work. I think we've kind of gotten that part set, and many of us who are familiar with the stellate ganglion block have come to that conclusion already. Okay, stellate ganglion block works. In fact, it works very, very well. The issue now is how does it work best and what way? So it's interesting, Jim just alluded to this, is what we're trying to figure out is, does the stellate ganglion block work best up front as you start therapy prior to an intensive outpatient session for cognitive processing therapy? So the finer points is where we're at now in the research community of trying to figure out how best to pair stellate ganglion block with things like EMDR or other types of trauma-focused therapy. So again, I don't want anybody to get the impression that we're just starting this type of thing. We've actually got close to 20 published articles in the literature now that support the use of stellate ganglion block. But you're right, it's not all figured out. We're still trying to figure that out. There may be people out there that are interested. I'm sure there's a mechanism where Jim will point you to the right website to see if that particular program would still benefit you, because it is nice. It's a trial that does not require you to pay anything out of pocket for that. So, Jim, I'm going to pause for a second there while you're, if you want to direct any specific questions, I'm not monitoring the chat room, or I can proceed with the topics we talked about earlier.
I don't have any, I haven't seen any questions yet. But I will ask you, so you talk about STRIVE and their clinical trial. I noticed recently on clinicaltrial.gov that the VA is doing clinical trials now as well.
Yeah.
Is that something that you had conversations with them about, or do you know anything about that? Or
I'll keep it short and say that the best thing you can do for that is if you go on the VA website, you can track down how and where the sites are for that. It'll be a multi-center trial starting here soon. I have great hopes for that. I'm not personally involved in that trial, although the folks running the trial and I have talked years ago about that. There are also other people that are doing smaller studies and looking at combining stellate ganglion block with things like prolonged exposure therapy. Others are looking at it for treating, just to expand it. We find that the block is helpful for things, not just PTSD, but the anxiety symptoms that go along with things like generalized anxiety disorder. It's also being looked at for things like depression and treatment-resistant depression. Either way, as far as the study goes, it's probably worth taking a step back and just explain it, because I'm going to make the assumption there's at least a couple people on here that are scratching their head going, what the heck is the stellate ganglion block thing? So it's probably worth just describing it really simple. It's literally a nerve block. So it's using a local anesthetic to inject under ultrasound guidance along the nerve that controls the body's fight or flight system. It's that simple, but it's helpful to have your story, Jim, to be able to explain the why, right? Because this is not a silver bullet. It's not like a magic trick or something. Clearly, this has had a significant impact on Jim. We just heard his story. Really, to explain that, the why, why did that happen? It's not, we understand this now. And when I describe it to people, sometimes they're fascinated and say things like, why the heck did we not figure this out a long time ago? So in my own simple words, the way I describe it is that the nerve that controls the fight or flight system, called the cervical sympathetic trunk, runs on both sides of the neck. It's essentially sole purpose is to connect the brain to the body, and it controls all the fight or flight system signals in both directions, brain to body, body to brain. And what can happen with people who are exposed to traumatic experiences in their past, or very stressful situations or occupations, which is quite common in things like the military and the first responder community, is that over time, that nerve can actually become amplified or dysfunctional and stay kind of stuck in the on position or hyper aroused. The reason people believe this is we all know, or many of us are familiar with other instances when the body has nerves that stop to work properly. So there's no reason to think that for whatever reason, the cervical sympathetic trunk would not be able to be injured in some way or stop working properly, when, I don't know about you, but everything else in my body seems to break down at one point or another. We know that from people that have phantom limb pain, that there are amputees who still feel pain in either their hand or their foot, and it's not there. The nerves that control those signals become dysfunctional and essentially stuck where they're carrying signals in an inappropriate manner. It's a very similar thing to what happens with the cervical sympathetic trunk. And it doesn't take just one instance. Sometimes, it can take just one instance. Other times it takes, a lifetime or a childhood full of repeated instances to take that cervical sympathetic trunk and ratchet it up so that it's no longer working properly, and the signals travel inappropriately, and it's broken essentially, because it lives in the autonomic nervous system paired with the vagus nerve and the parasympathetic system. It's autonomic, so it's automatic. Essentially, it's a reflex. That's how we were designed, for that to be protective for us. So in Jim's case, his experiences, and many other people have experiences where you're going about your daily business, and through protective mechanisms, your sympathetic nervous system becomes slightly aroused over time. And I'm not using this as kind of the only explanation for Jim, so pardon this oversimplification, but part of this certainly is that an overstimulation of that nerve then can result in signals that travel body to brain, brain to body, and back and forth. They feed back on themselves, much like a loop or a circuit. And the circuit, the brain is a plastic structure, and the circuit can essentially become hardwired like that, so that you become you can manifest with things like difficulty in sleep or concentration. Many people have irritability or heightened arousal or just anger. You go 0 to 60 for what seems like no reason. Immediately afterwards, you think, what the heck did that happen? What was that? I know it was wrong, and something in my body caused that. And somehow I can't seem to control it, regardless of how hard I try or how hard I pray or how hard I will myself to. And what we can find is, if we simply put the nerve to sleep using a medicine called ropivacaine, long-acting anesthetic, we just numb the nerve, literally shut down the highway there. It wakes up again in 8 hours. And in that period of time, it allows the nerve to reset or reboot itself, to use an impersonal term. This sounds extremely simple and almost like a little stupid or too good to be true, but that same procedure has been used for 100 years in pain medicine since the 1920s to help reset nerves to control sympathetically mediated pain. So this is nothing new. It was simply just taking some ideas and marrying them together. And the result then is, if we can uncouple the brain's memories and thoughts and cognition from the physiologic response, it can allow you a little breathing room, a little pause and a chance, like Jim already mentioned, to really dig into therapy. So the block is really essential to be paired up with the proper therapy to really get at the root issue. But it can put you in a state where you are now physiologically able to be calm enough in your body and really engage in things without it just being untenable.
And Dr. Lynch, if I can, I would like to add on that. So I tried EMDR before receiving the block, and after one session, I was a mess for like 2.5, 3 weeks. And I know that you're just supposed to take little bites, but I couldn't handle it. And now I'm ready to do it. And I feel a lot better about it, and I'm more comfortable with it. And this is why I wrote down my story, because I knew that I was going to forget something. But recently, so on New Year's Day, I told you in my story that this was really all started with some fireworks. And my neighbor here was blasting off fireworks, and I wasn't triggered at all, not even a little. And that is huge for me, and really, really incredible. And I pointed out a few times that I got this in November. I know it's only been a few months, but I've really dug into therapy. But in a few months, I'm still not being triggered. That to me is huge. And we do have some questions, if I may, if you're ready for some. Okay. So one of the things that was asked again is PTSD with TBI. Are there any negative side effects to the block, or is it something that could still be recommended? Or
Yeah, that's a great question. So I think there's, first of all, the short answer is we're finding that stellate ganglion block is actually extremely helpful for TBI. But let me caveat this. So we already know, or many of us are familiar, many of us have PTSD and TBI, and we know there's an overlap in symptoms. However, there are some things that are more on the TBI area in terms of symptoms when we think about things like, so for a mild traumatic brain injury that has some residual post-concussive effects in terms of things like brain fog or persistent headaches or things like that. What we found, and I'll say, I don't want to say it like this, but almost by accident, but really just through experience of taking care of lots of people with blast or blunt trauma to their head, is we noticed that when we started to perform left-sided stellate ganglion blocks, which requires some explanation, so I'll come back to that. Primarily, the block has been performed on the right side of the neck for these symptoms, for mental health symptoms since inception. And a few years ago, we started exploring the results of left-sided stellate ganglion block. When we did that, there was enough anecdotal expression of people who had PTSD or bad anxiety symptoms and also had a history of traumatic brain injury that some of the other symptoms improved as well. So this is something that we're looking at now, we're studying now. This is premature to say things definitive. So please, I hope that nobody will misunderstand me here. But I can tell you that right now at our institute, we track and we take an instrument called the NSI, and we look for traumatic brain injury symptoms, both pre and post stellate ganglion block for anyone with a history of TBI. The why is the more important thing to me. I guess I like to explain the reason why. What the stellate ganglion block does is it actually changes the blood flow in the brain. And this is something that happens immediately. So within the first couple of minutes after the block, all the blood vessels inside of the face, inside the nose, the sinuses, and the pial vessels inside the brain actually dilate. So we know there's a physiologic response to what the block does. The issue with residual problems from TBI, so this is coming from two different directions, right? Because the people in TBI research, of which there are some wonderful places around the world, some of you quite aware of them that are on this call, but the explanation is looking at small structures in the brain, particularly the glymphatic system, to explain what is some of the problem from concussion. And I think this is all hypothetical, so please don't say this is hard science or anything, but we believe that the changes of blood flow in the brain are actually the kind of thing that may in fact be contributing to some resolution of TBI symptoms. I think it's fascinating. This is ripe for lots of research. This is not ready for prime time. But in the meantime, what we do is we have the opportunity to perform a right-sided stellate ganglion block on someone, which we always do first, and I'll explain. But for many people who have a history of TBI, they'll ask for, and we will recommend, we should probably block the left side as well. Because it's not safe to do both on the same day typically, we usually recommend people get a right side on one side, right side one day, and come back and get the left side done the next day. And we've been doing this now for several years and tracking our responses, and we seem to have really nice anecdotal results from that. Again, none of this is hard science or hard literature, but definitely worthwhile. And the mechanisms at least are suggested that there's some plausible explanation for that. What I try to say is for people, I just use softer language, and I hope that's okay, but I'll say, if you've had a history of TBI and you still suffer from some post-concussive symptoms, then certainly it's worth considering a left side stellate ganglion block if you're going to be having a right side as well. A left side block is not really a standard thing, but it's something that we perform safely every day. I just did one just a couple hours ago. So the procedure is essentially the same as on the right. Let me pause there. And incidentally, I'm happy if this thing turns into Q&A is easy. I think a lot of the base foundational information can be found online. It certainly can be found at our website. But if people have questions, I'm happy to answer those. I'll be easy with that.
Yeah, they're filling up, Dr. Lynch. So another question we have is from Stephanie. We've provided over 30 SGBs here in Central Georgia. I've only had one combat veteran who seemingly did not respond to 2 right-sided blocks. What would you have me tell this veteran to help her understand why and how and where we might try again? She is a single mom to a very young child, and her guarding reflex is very strong.
So great question. I'll broaden it and apply it to anybody. So if you know of someone who has had a stellate ganglion block, been performed, and it wasn't successful, right? So that's really the basic question is, hey, what the heck? We tried this. It's supposedly, such a good treatment. What if it didn't work? Then we went and repeated it again to see, and that didn't seem to help either. The research that we published on this to look at that is you generally get about an 85% success rate from a right-sided stellate ganglion block. So in English, 85% of people will have a dramatic response to their symptoms. When I say dramatic, I mean cut in half. I mean 50% reduction in symptoms by the next day, which if you're familiar with treating PTSD, there's no other treatment that's even close to that in terms of the other therapeutic modalities. Having said that, that's about what we see. For the other 15% of people, usually, rarely does anybody get worse, and very rarely does anybody even stay the same. What you might get is a little bit of an improvement, like a couple of points on a scale, which I think is quite disappointing. So we call those people the right side failures. No offense, not to their face, but people that don't respond vigorously to a right side block. What we did, and this is published in the literature, is we then repeated the block on the left side, and this is what led us down that path that I just made reference to a couple of minutes ago. Was somebody had the bright idea, hey, why don't we try it on the left? That's never been done before. And what happened is, anecdotally, a couple of people that did not respond on the right side responded wonderfully on the left. So we studied this, and essentially, if you take right side non-responders, repeat the block on the left side, 90% of those people will have a vigorous response. So the short answer to the question that was posed would be try the left side. The bigger answer is this, trying to explain the why or predict who could benefit from right versus left, which at this point, we don't have a good way to predict. The more complicated answer is that it's not perfectly clear where you're either a right side or a left side responder. We've now treated hundreds of people with both right and left side blocks, the same person, and many of them get a vigorous response with the right side block and still a vigorous response on the left side. So there's definitely benefit, and it's not as clear cut as just a right or a left side responder. But that would be my long answer to a very simple question of what next. If this is the kind of thing, Again, this is what we do. This is my specialty. So I know there are other people that perform stellate ganglion block. I'm happy to always take someone on, and what I would do is a little level deeper, looking at specific symptoms and see if that's the right thing to do or not. I'm always happy to, take a referral from somebody else or another site. That's easy. I hope that answers the question.
Yeah, and then another one that I had was, what are the steps that a veteran can go through to begin the process of a referral to an SGB clinic?
Yeah, great. So two things. One, if you're first of all, if you're active duty military, there are hospitals in active duty military treatment facilities that perform stellate ganglion block. And they don't always stay the same depending on where the doctors move to, but there are several that have been habitually performing that procedure. Landstuhl in Germany, Tripler in Hawaii, Fort Bragg, a couple others, Walter Reed in DC. So there are active duty locations. For veterans, the number waxes and wanes and also migrates in terms of which VA hospital has somebody who's trained and can provide a stellate ganglion block. I'm in Maryland, and neither the DC nor the Baltimore VAs have that ability, and we haven't exactly synced up the ability to share that, unfortunately, but hopefully we'll get there soon. So you can certainly, if you're a veteran, start at va.org and ask that question. What's the closest clinic that I can go to, or clinic or hospital where I can get a stellate ganglion block? The second is, Jim mentioned that there is a veteran study going on within the VA hospital. If you are a veteran and you're interested and you've not had stellate ganglion block before, I'm happy to see you right here in Annapolis easily if you can get here as part of that STRIVE study where you don't have to pay for it, and that's great. As far as veterans living across the country or overseas, there are other places that perform the stellate ganglion block. There are a variety of ways it can be performed. Some doctors are trained to perform the block under fluoroscopy, which is under a live X-ray procedure. Many are trained that way. There are varying levels of experience with the procedure. In my experience, most physicians who perform the procedure may be technically competent at doing the procedure, but may not have the background understanding of all the other things like the effects of counseling and things that go into that. So you might not find that, but you might find the procedure. It is not covered by insurance, and that's probably one of the biggest barriers, to include TRICARE. So while it's performed on active duty for people, it is not a military beneficiary covered thing under TRICARE, which seems odd, and maybe we'll change that someday. But it's not covered by insurance. If you look around, there are, as a veteran, if you're interested, there are places that charge out of pocket, cash around the $3,000, $4,000 procedure charge for that, where it's performed in an operating room using sedation and a lot of things that I personally find unnecessary and potentially increase risk. But that is done, and you can find somebody that could probably do that and pay those type of prices. There are people that will perform the block, like I said, perhaps in a state nearby you. We perform the block here under ultrasound guidance, both myself and Dr. Mulvaney, who have 12 plus years of experience doing this. Our cost for veterans, we try to keep at our break-even cost, and we do that just to make it accessible. There's still an out-of-pocket cost associated with that, but we happen to have some great benevolent organizations who are willing to sponsor veterans if they're not able to pay for it, and those range from a variety of services. Usually our front office staff is helpful in connecting the dots there. If a veteran says, I want to come here to the Stellate Institute in Annapolis, Maryland, I want to have Dr. Lynch or Dr. Mulvaney do my procedure, but I can't afford it, they can usually find, or many times I should say, find a benevolent organization that can help. I wish there was more of that out there. Frankly, I wish there was a lot more out there for people like first responders, survivors of childhood abuse and sexual trauma as well. But that doesn't exist to the extent that veterans really do have some options for that. I hope that answers that question.
Does.
I'm going to answer another one that you asked me, Jim, that comes up all the time.
Please.
Which the term CPTSD or complex PTSD is sometimes used to describe which is not really an official, I can say it like that. It's not in the DSM-5, but it's a commonly used term to describe trauma that comes from repeated experience, whereas sometimes people will think of PTSD, pure PTSD, post-traumatic stress disorder, as maybe from a single or a brief episode, a one-time thing. This is not necessarily the place to debate or discuss all that. But let me answer this question, which comes up all the time, particularly from people who are survivors of childhood abuse or repeated trauma of any type. And pardon me if I'm bringing up terms that are problematic to you. For those people, we get many, many people who come here with symptoms through the roof, maxed out, that have had terrible times dealing with their traumatic experiences, and whose sympathetic nervous system is cranked all the way up. And they have very, very nice responses to the stellate ganglion block. For some people, a block may not be a one and done, never see again type of thing. Some people who have very deep-rooted symptoms may require repeated treatments. The block's been done, stellate ganglion block, since the 1920s safely. And when it was first originated, when it was performed blind by just touching a bone and injecting next to your finger, it could be done several times a week safely on thousands and thousands of people before the advent of ultrasound and fluoroscopy. So the procedure itself is very safe to perform repeatedly. It's just a numbing medicine, so it does not, you don't develop tolerance to it. It's not like taking a medication where you're taking something every day and you have to potentially build up tolerance and increase your dose. So because of that, it's very safe to repeat the procedure. And anybody who does usually has the same response as their subsequent blocks as their original one, meaning I would still look for a 50% reduction in symptoms. So people who get treated multiple times can sometimes step down things as they're moving through their therapy and may hit a rough spot. I hope that answers that question.
It does. So, Dr. Lynch, I have a question, and maybe I missed this, and I apologize for that. But your work with special operators is kind of what started this, right?
Yeah, it's so people usually ask that. I think, so the patients I treated this morning, we talked a little bit about how the procedure works. And so many people say things like, why don't we figure this out sooner? Like, how did something that seems so simple, and like you could hear Jim's story, like makes such a life-changing difference that takes literally 6 minutes to perform and has been done safely. Like, why the heck has it taken us this long to figure this out? I don't want to, pretend that it's the silver bullet. It's not, but it's a life-changing thing. And its origins are actually kind of interesting, but there's a group, Leibovitz and all, who published the first case study describing the use of stellate ganglion block that resulted in dramatic relief for PTSD. And that was back in 1990. And it was a simple case study. It was a case of a teenage woman who was assaulted, received multiple gunshot wounds, and the stellate ganglion block, like I said, has been used to treat pain for many, many years. In this case, she had significant pain in her shoulder from a gunshot wound. So the block was being performed to treat her pain. At the same time, she had debilitating post-traumatic stress disorder and was completely unwilling or unable to engage in psychotherapy because it was just beyond her control. She couldn't, she was too amped up. She could not, she wouldn't even go see a psychologist, and she was essentially homebound. When she had the block performed for the pain, her PTSD symptoms changed dramatically to the point that she actually sought out, went to psychotherapy, had a wonderful response. It was described in this case study in the literature, and then it kind of sat there. To me, it was remarkable that nobody picked up on this earlier or did something with it. And then later on, as Dr. Mulvaney in the military is probably the one that should be credited most with really looking around for what else can we do for our teammates. Frankly, we had plenty of people who describe a story a lot like Jim's, which is exposed to traumatic experiences and then muscle through it, continue to go on repeated deployments over time in the special operations community. Where I was at Fort Bragg, Dr. Mulvaney was up in the DC area at that time. We worked with a very close cohort of people who were very elite soldiers that were deploying frequently and still required to perform their jobs. So many of them were averse to seeking out therapy, or certainly averse to medications. Not that those things are wrong or anything. I'm just explaining how the story came about. So it led Dr. Mulvaney to look for a better mousetrap, essentially. Hey, what else can we offer these guys? And he found a gentleman in Chicago who was performing the block for pain and had a similar response to what Leibovitz did. So then we had an initial experience in about 2010 was published, the first case series of military members who were treated with stellate ganglion blocks specifically for post-traumatic stress symptoms, and had a dramatic result. Shortly after that, Dr. Mulvaney and I have been friends for many years. So both of us were quite skilled and certified in ultrasound guided injections based on our background. We both became certified to perform the procedure itself, and then really started working that within the special operations community as a pretty integral part of how we treated behavioral health in our small closed community. That kind of opened up a little bit and broadened out across the military. And it hasn't really made the giant leap into the VA yet, nor has it into civilian practice. And when I retired last year from Fort Bragg and moved up to the DC area, I found that many therapists, psychiatrists, psychologists, and social workers had never even heard of it. And I was shocked because meanwhile, we published a level 1 evidence randomized controlled trial in JAMA Psych 2 years ago, and people had never even heard of it, let alone were using it for their patients. So, this has been a short period of time over the past 12 years from real inception to trying to get the word out, but it's certainly slow, and it can be frustrating at times to try to raise awareness, which is, the benefit of doing something like we're doing today.
Well, I'll tell you, here in New Hampshire, the mental health community is far better educated. Like I told you, we went to a mental health conference in Manchester in November, and I handed out about 100 of your cards and explaining the procedures and things like that, and really got into it and how it was life-changing. And I talked to a lot of therapists and psychologists, and so they're definitely educated up here now.
Yeah, I hope so. And I think it's fair to say that there are people. So the Center for PTSD right there at White River Junction, Vermont, right across the border from you, is really, renowned center of excellence for this topic. I've had many conversations with them over the years. And there is, because the VA, much like the DoD, is a large organization, they can sometimes take extra time, and certainly don't want to do things that are not evidence-based for their beneficiaries. I understand all this. And I think that the tide will turn, maybe with the addition of another randomized controlled trial or two. But in the meantime, we're going to continue to use this therapy as much as we can until, until there's people feel like there's enough evidence to convince them to adopt it a little more broadly, which I think will happen quite soon.
Well, I can tell you that it's happening because White River Junction is now offering on a limited capacity SGB, as long as they're using it more for like treatment resistant PTSD. And I only know that because my prescriber at the Manchester VA was astonished at my turnaround and how well I was doing, and was like, well, if it starts to wear off, let me know, because we'll get you up to White River and they'll do it again for you. So
great news. And I think that will start to trickle. I hope my hope would be it's not reserved for treatment resistant. I actually think that's a little backwards. I think that the block is quite helpful for treatment up front. And I think, people who are not familiar with it, we'll figure that out. We already, like I said, we're doing studies now to actually demonstrate that and show it, because it's really an adjunct therapy. It's not like something you keep in reserve.
Yeah, and from my experience, I would agree with you. So, and I think that, I do a lot of, so in my capacity up here, I do a lot of reaching out to TAP programs, which anybody who's served knows what that is. And when you're getting out, you have to go through all these classes. And this is something that I bring up now, and not to fight it alone, and not to think that you're strong and you'll get through it, and to really try to get a handle on it before it overtakes you, because that's what I allowed. So, and it's really just become part of my presentations there now.
Great. Thank you.
Yeah, I am an advocate, Dr. Lynch, for sure. I'd like to call myself an ambassador.
Okay, I like that. If there's any other ambassadors on the call, if it's an appropriate thing or anybody wants to raise a hand and say something, certainly not asking for that, but I think that there are a lot of people who do enjoy, and I think it's actually helpful for some people to hear, not from the doctor that does them. I'm obviously biased, right? I mean, this is my life's work. Sometimes I think it's helpful when you hear from others. So that's why I think it was really
Absolutely.
valuable that you shared your story, Jim.
If anybody else wants to chime in and let them know, let us know. Yeah, please, Stephanie and then Kevin, is that okay? All right. Stephanie, go ahead and
Unmute me.
yeah, there
Hey.
you go. Hi.
Hey, so I thank you, Jim, and hey, Dr. Lynch. I want to say that I've had some profound experiences myself. What led me into getting my first block was seeing Dakota Meyer's 60 Minutes interview. I was like, what the hell's that? Well, we should be doing that, right? So we should be raising money. We should be helping veterans get access to that. So then we should find someone to provide that. So then I was the guinea pig and boom, whoa, right? Why aren't we doing this across our country in a huge way? Was my perspective. But the thing that really blows me away is how many times I see people in front of me change, like overnight, 24 hours. It's like they're different people. And we provide equine therapy for combat veterans here on our ranch, in addition to help finding other things that work, that support that therapeutic process. And this is one of them. But I had a young Army Ranger, significantly blown up, having seizures and really struggling with his symptoms, who after his first block, he lived on the ranch. And after his first block, he came back out to the horses, and it was like, his words, and I'll quote, were, "My friend's back and he's not crazy." So the response of the horses to him and his observation and ability to recognize that he had changed was so profound. And that is, anyway, that's the story I'd like to share. And just want to thank you both, Jim and Dr. Lynch, for doing this, because this will ripple out. And then the resources that you're sharing will ripple out too amongst all of us to help everybody else.
Yes, thank you. Also, so this is being recorded. We have social media. We have a website. It's DMAVS.nh.gov. DMAVS. I'll put it in the chat also.
Sure.
But we are going to post this video there. We're going to share it with Dr. Lynch so that he can post it also. And we absolutely would love it if you just keep an eye out and just share the video with anybody that you think might benefit from it. I want to share my story with as many people as I can. That's why I've shared my email, because if somebody and on our website I have an office phone number. They can call and leave a message and I'll get back to them. I will talk to anybody about this and how life-changing it is. I wish my wife would have agreed to come talk to you, because she would tell you that before this she was on the verge of divorcing me, and since then I'm back to being that guy that she really fell in love with. And so she won't do it because of a lot of things, but also it inspired her. She's about to start a master's program to get in to become a mental health counselor. So it's really thank you, Sean. And it's really changed a lot of things. So thank you so much. And I'm really hopeful that my story can help one person at least, and if I can help one person, then it makes it all worth it. So Kevin, I know you had raised your hand also, sir, if you want to speak.
Sure, I'll be brief, Jim. I met Dr. Mulvaney probably a couple of years ago. I've talked to Dr. Lynch a couple of times on social media. My wife's on the call. She's just kind of listening in. I had both sides done. I traveled down to the Institute. I am a mental health counselor. I'm finishing up my PhD in trauma, working with first responders. And I can't share it enough. And some of my colleagues will say, "Hey, can you come talk to one of my veterans and share your story?" because my colleagues, a lot of them had worked with me prior to getting the treatment. And like I said, I went down there, I did the right side. I had already scheduled to do both sides. I did both sides. And I believe that I was able to unpack stuff even probably from childhood, not just from my combat deployment. So I'm going on, I want to say about 2 years now. And one of the things that I think is kind of cool, I'm not sure if you've had the same experience, Jim, is my senses, it's almost like Spider-Man, right? So like I can see clearer. I don't really wear my glasses much anymore. The birds are louder. It's just my senses are off the chart. I'm a martial artist. My grandmaster that I train with black belt says that I almost have precognition with some things. I can just see, hear, and smell and understand quite better than I did before. And I think it was kind of like having a fog lifted off me. I struggled hard in my education through my PhD, the PhD process. And now it just, the weight was just taken off me. I'm able to enjoy school more. I enjoy my work more, enjoy my life more. I'm happily married. Life just couldn't be any better. And I do attribute it to the procedure, and I do share it with I tell everybody I come in contact with. I talk to someone in the grocery store and say, "Hey, how you doing?" Not only do I want to get you help get you into treatment if you're a veteran, but I also there's this cool procedure that might support you with that. So thanks for having me on, Jim, and thanks for sharing your story. I think that's great. It's great to meet everyone. Dr. Lynch, it's good to meet you in person or on video. So thank you.
Kevin, you look really familiar. I feel
I
like
get
I've
that a
seen
lot.
you before.
I don't know. I'll have to
Are you-
shave. I haven't shaved. I'm on my day
Are
off.
you here
so
in New Hampshire?
I am here in New Hampshire. I work for the Department of Veterans Affairs. I work at the Vet Center in Hooksett, New Hampshire.
So I go to the vet center. That's where I know you're from. Tell Mary that I'm very disappointed that she wasn't on this call today.
So okay. Mary and I we're all on leave today, so maybe
Oh,
I think Mary's at the range today, so she's
yeah,
not gonna-
that makes sense. Yeah. Yeah.
But I do share it in our community with a lot of folks I work with. So
Well, and I've told Mary also, and but if you're in Hooksett, but anybody really, but I am more than willing to talk to anybody about this. So if
amazing.
yeah, if they are kind of like, well, of course you're saying this, well, send them to me. I don't. I'm just a guy. I'm just a guy who's trying to get people employment here in the state. That's really what I'm here for. Who suffered from PTSD and now feels all new. Like I was saying, I came back to New Hampshire and it was a really windy day, and I really like the cold on my face just felt different. Yeah,
It's hard to explain that to people.
Yeah.
About the your senses.
Yeah.
Thank you.
Thank you, Kevin. Well, Dr. Lynch, it is 1 o'clock. I'm not seeing any other questions. Let me just make sure. I'm sorry.
Yes, I certainly, while you're scrolling through it, I think I tried to skim through there. I saw a lot of familiar names. I love the fact that people openly are supportive. I think that there are people who will feel better with whatever, just as a general term, and give it the kind of, I got mine, and I'm happy that I'm doing better, but they're not willing to go out and help others. And I know that there are many people who, after they feel better, make it a mission to get the word out. So to those of you who, and particularly share some quite intimate things, and that's a big deal. And I appreciate it. So from us here in Annapolis, everyone who shares their story, to me, I always feel it goes with about 10 times more credibility than I bring, because I'm just, a doctor, and I'm not stupid. I know that there's, should, and rightly so, skepticism of the medical community, and there should be, right? People should be good consumers of the medical literature and the information that's out there. I dropped a link into the chat box there of our website. If you haven't been on it yet, it was designed for both patients and clinicians. So if you're a behavioral health professional on here as well, we put all of the full text journal articles for the research studies on the evidence page. But on the frequently asked questions page, a lot of people go there. We put videos too, and we have the videos on our YouTube channel. They're essentially just to elaborate around some of the frequently asked questions. I hope that's helpful to someone or to someone that you may refer or point to that direction. It's really, part of the game here for me and for Dr. Mulvaney is I spend about 45 minutes to an hour with every patient. And the first 30 or 40 minutes or so is really explaining the why and the science and the background, all that I think matters. And putting people at ease before we perform a procedure. It's nerve-wracking and everybody's anxious before it. And the last thing you need is to have that, anxiety elevated by having, a bunch of scary medical stuff around and whisked around and having a, scary atmosphere. So we try to make it pretty mellow here and take our time. And I think that makes a big difference. So, so some of the questions are, a little longer, a little answered with a little more elaborative language on some of the videos. I hope those will help. And if you have a question that's not on the FAQ and you want to reach out to me directly, I'll put it on there. Like, I want this to be really educational and helpful.
Yeah, and again, please, if you have anybody who just wants to hear from someone, I might be in New Hampshire, but I'm available to anyone anytime. Yes, absolutely. Anybody can call me. I don't have my office number right on me, but if you go to dmavs.nh.gov, my office number is on there. I only say that because I started giving out my cell phone number for a while and it just didn't stop ringing. And I have an 11-month-old, almost 1-year-old at home, and she was getting woken up in the middle of the night and whatnot. So my office phone is great. I will get back to you even if it's not during office hours. There we go. 603-227-1569. Sean Jones is the man. He works with me also.
Hope Sean didn't drop your cell phone number in there.
Nope, thankfully not. But yes, Dr. Lynch, thank you so much. I'm sorry to kind of drop a little bit of my story on you. I know that you didn't know a lot of it, but I am thankful to you every day and thankful for all that you do, not just for me, but for every veteran out there. And my whole life is about trying to give back, and I want to give back too. So if there's anything that you need or that I can do for you also, please don't hesitate to reach out. I'm happy to do it.
Truly appreciate the opportunity to do this. And thank you everyone who took time out to listen to this. So, and thanks so much for sharing your story, Jim. Really very impactful.
Thank you. Yes. And thank you for being on. Truly, I can't thank you enough. I'd like to thank everybody for taking their time out. I will throw a couple plugs out there. Please follow Dr. Lynch, the Stellate Institute, and New Hampshire Department of Military Affairs and Veteran Services on Facebook and LinkedIn. And stay in touch. If I can do anything for anybody, please don't hesitate to reach out. I'm always happy to help. Goodbye, everybody. Take care.